Guys, today I'm going to talk to you about the different types of hemorrhoid surgeries that you can have if you've got hemorrhoids and they're bad, and you might have chronic hemorrhoids. It can really put a damper on your life and make everyday living very difficult. So there are times when surgery might be a good option for you. That's something to speak with your doctor about. But we're going to discuss the most common types of hemorrhoid surgeries and just kind of give you a general overview. And that's something you're going to want to discuss with your doctor if surgery is an option for you. But let's jump right in. As you can see here, I have a diagram of the hemorrhoid banding surgery up. Essentially, what hemorrhoid banding is it's also known as rubber band ligation. But once the doctor locates the hemorrhoid, they'll wind up tying it off with a rubber band. And basically, what that does is it cuts off the blood supply to this hemorrhoid, and then the hemorrhoid eventually dies and goes away. Now, something to note: sometimes with these, you will have to go back in for a second or third treatment if the hemorrhoid hasn't gone away with the first banding. So that's something to think about. The nice thing about hemorrhoid banding is there's very little side effects compared to some other more invasive hemorrhoid surgeries, which we'll get into. So hemorrhoid banding is a very good option. It's not quite as painful as some other ones, and it's a relatively non-invasive hemorrhoid surgery. So we'll go ahead and move on. Sclerotherapy is another type of hemorrhoid surgery where basically you're just injecting the hemorrhoid with a chemical, and the chemical basically shrinks the hemorrhoid. This therapy isn't the most painful therapy. I mean, obviously, using a needle in the hemorrhoid is going to hurt quite a bit, but compared to cutting out the hemorrhoid or another type of surgery, it's not quite as bad. So this wouldn't be a bad one to discuss with your doctor. It's not as popular as banding, so your doctor might decide to go with banding, but definitely something to bring up, an option that you might want to take a look at. And actually here's a little banding here as well, but this is sclerotherapy on the left here. So we'll move into the next one, which is infrared photocoagulation. Say that one 5 times fast. This uses infrared light, heat or cold, basically to shrink the hemorrhoid, and it causes it to retract. It's another good option. Doesn't cause too many side effects or pain. So infrared photocoagulation wouldn't be a bad option to discuss with your doctor. Once again, this isn't as popular as hemorrhoid banding, but might be something to check out. Now, if we move on to the hemorrhoid artery ligation, what this one does is using ultrasound, this device here, the doctor will locate where your internal hemorrhoid is. Obviously, this is an internal hemorrhoid, and basically just, as you can see here, tie that hemorrhoid off. And basically what that does is kind of works like the banding. It just the hemorrhoid winds up dying, and you're good to go. So this is another decent way to get rid of your hemorrhoids, using ultrasound and tying the hemorrhoid off. So might not be a bad idea to discuss this one with your doctor as well. Moving along, here we have the very traditional, very widely used hemorrhoidectomy. And basically what happens is the doctor locates the hemorrhoid, comes in, and as you can see, cuts it out. And once the hemorrhoid is cut out, the tissue is sewn back up, and you are sent home. This one does come with more possible side effects. You can get infection, you can bleed. There's a lot more that goes into this one. It's also very painful. So it's a very common surgery, but once again, this is something you're going to want to discuss with your doctor. It can be quite painful. It does involve a risk of infection, so something to think about. Finally, we have a hemorrhoidopexy, which is also known as stapling. And so basically, what happens is the surgeon will come in and they'll basically find the hemorrhoid and then they'll staple it and cut off its blood supply. And basically what this does is it shrinks the hemorrhoid tissue and makes them go away. So this, once again, it's not a terribly bad option, but it is a bit more invasive than some other ones. So, you might want to start off discussing, like hemorrhoid banding, maybe even the sclerotherapy or coagulation therapy, and then move along to the other ones. If you do have serious case of hemorrhoids, your doctor might recommend the hemorrhoidectomy or possibly this hemorrhoidopexy. But discuss with your doctor and see what your best treatment options are. So I hope you enjoyed the hemorrhoid surgery video, and if you have any questions or comments, feel free to message me below.